This video is about the glycemic index. When you go on the internet, you can find categories of good foods, bad foods, and one of the things that you will see is the good carbs and the bad carbs. The simplistic view that's presented many times is that complex carbs are good and simple carbs are bad. And one of the reasons that's given for this difference is that complex carbs have a low glycemic index, which is good, and simple carbs are bad because they have a high glycemic index. So I just wanted to remind you of what simple and complex carbs are. Complex carbs are those carbohydrates that are formed from chains of 3 or more monosaccharides, and that includes starch and fiber. Simple carbohydrates are those that have either 1 or 2 monosaccharides hooked together. So here's a figure from your textbook which gives you some examples of foods that are particularly rich in complex and simple carbs. So foods high in complex carbs, all of these things that are made out of flour, and then some vegetables that have peas, legumes, squash, corn, and then simple carbs. There are some foods that have simple carbs because they're naturally present. So we talked about how milk products and also fruits, those are the sources of these simple carbs in the natural world. And then of course all of the foods that we make by adding simple carbs to them to sweeten them. Alright, so remember those foods that I showed you. So according to that simple good carbs, bad carbs, remember that simple carbs are the bad ones and complex carbs are the good ones. So in this table it lists the glycemic index, which is over here, for each of a bunch of foods. And there are tables like this with glycemic indexes for over 7,000 foods. So this is just a few of them. What you can see is that maltose and glucose have the highest glycemic index. The glycemic index is calculated relative to glucose, so that's why it's 100. Maltose is actually absorbed faster than glucose. And remember that it's not absorbed faster, it goes into the bloodstream faster. Remember that maltose is 2 glucoses hooked together. So if it was based on complexity, you would think that it would be glucose that would have a higher glycemic index than maltose, but it's the other way around. Also notice that sucrose, which is a disaccharide, it's a simple sugar, has a lower glycemic index than glucose. Alright, so right here you can see that the generalization that monosaccharides are, simple sugars are bad just doesn't make sense. Let's look too at potatoes. Now remember that potatoes have complex carbs. They have sugars. Complex carbs, they have starch in them. And yet they have a high glycemic index. Peas, on the other hand, are also plants and they have complex carbs, but they have a lower glycemic index. So the generalization here, both of these have complex carbs, but the glycemic index is higher for potatoes than green peas. And then finally, yogurt. Remember that yogurt is made from milk and it has lactose in it, which is a disaccharide. And this is one of these foods where in the previous table that came from your textbook, it said that this is naturally rich in simple sugars. And of the examples that I pulled out for you, yogurt has the lowest glycemic index, even though it has simple sugars in it. So, and then finally, before we go on, we all think that whole wheat is what whole grains are good because they have lower glycemic indexes. But if you look at the relative glycemic indexes for whole wheat bread and white bread, they're very similar. And surprisingly, whole wheat bread actually has a slightly higher glycemic index than white bread. So even though whole wheat bread has the bran and the germ, which has the fiber in it, nevertheless, it has a slightly higher glycemic index than white bread. All right, so obviously that simple carb, complex carb dichotomy is not very good for predicting the glycemic index of various foods. So take a look at this list and see if you can see any underlying pattern that would allow you to predict which foods move rapidly into the bloodstream and which are the slow release, low GI foods. So one thing that you can use now that the simple carbs, complex carbs dichotomy has been thrown out is gastric and emptying. So the rate at which a food is released from your stomach is a better predictor of whether or not a food has a low or high glycemic index than is its content or the number of bonds in between the monosaccharides. So here is a graph where on the y-axis is the change in blood glucose levels. So in other words, how high that spike is, how high that glucose spike is. And this one is the time that it takes for a food to leave the stomach. And if you take these foods, bread, mashed potatoes, rice, and spaghetti, and plot them on the graph, measure gastric emptying half time and the height of that blood glucose spike, you can see that these foods pretty much fall on a straight line. So in other words, what that shows you is that the reason that the glycemic index may be high or low has more to do with how long it takes for the food to leave the stomach than it does for its digestion. So that allows you to ask the question, if you need to predict glycemic index, which things slow down stomach emptying and which things speed it up. And if your food has a combination of carbohydrates with things that slow down stomach emptying, then that will have a lower glycemic index. And if that food is in a form where it speeds up the stomach emptying, then that will have a higher GI index. So what are the factors? And this actually comes from the digestion chapter. Fat slows down stomach emptying. So think of, I think one of the most striking observations is that ice cream, lots and lots of sugar in it, is also high fat. And because fat slows down the rate at which the bolus of food leaves the stomach and enters the small intestine, that ice cream has a really low GI index. And that makes sense. Likewise, foods, if you can put them into some sort of a salad, so that if they put vinegar in them, or if you mix them with acidic foods like tomatoes or citrus fruits, that will lower the pH, and they will take longer. And the other factor in the diet that slows down stomach emptying is fiber. So foods that are high in fiber tend to leave the stomach. They're slower to leave the stomach. And when you look through the list of foods, you'll see those things which have high fiber, not necessarily which are complex. Of course, fiber is a complex carb, but it's fiber in particular and not starch that determines the glycemic index. So what speeds up stomach emptying and digestion? Two things. If the food is in a liquid form, juices, sodas, it speeds through the stomach more quickly than if it's in solid form, like solid fruit, which also has fiber. Also, another thing that happens is anything that grinds up or pulverizes the food tends to speed it up. So that is why the processed cereals have a higher glycemic index than the cereals that are not processed, even when the food the cereals are whole grain cereals. So think of instant oats have a higher glycemic index than rolled oats. And also the milling. So polishing of rice and removing the bran and the germ from grains, that will speed up stomach emptying and digestion too, because this has the fiber in it. So take a look at those foods here and see if adding that information about fat content, fiber, and processing helps to make this more comprehensible. So let's talk now about the glycemic index itself, now that we've defined it and I've given you some guidelines for how to recognize foods with high or low glycemic indexes. Why does it matter? Why are we even talking about it? The interest in the glycemic index started back in 2002 with a study that was released called the Nurses' Health Study. That's not Healthy Study, Nurses' Health Study. And in this study, what they did is they took 32,000 nurses and followed them for many years. And what they did at the beginning was they asked them to just give the researchers a diary so that they could get an idea of what their eating patterns were. And what they found was that when after they waited a while for the natural health things to happen, there was a certain number of nurses, 915 in total, who came down with type 2 diabetes. So what they did is they went back and did a case control study and matched those 915 nurses to 915 matched controls who didn't have the disease, and then they looked at the correlation between the glycemic index of their diet and which group they were in, whether or not they ended up coming up with type 2 diabetes. And when they compared the nurses who had the highest GI diet to the nurses who had the lowest GI diet, they found that those with the highest GI diet had a 40% increased risk of type 2 diabetes. So that is where the glycemic interest in using the glycemic index to prevent diabetes came from. So then a follow-up with this was nurses, and I think they restricted it to women. As a follow-up to that, they did another study with health professionals, which included more men. And based on this study, they came to the same conclusions about the glycemic index. Okay, so based on these observational studies, in 2002, they came up with a model for how it is that high glycemic load, which is glycemic index times number of grams of a particular carbohydrate, how high glycemic load caused diabetes. And what they suggested was that when you have a high glycemic load where you have these rapid and high spikes in glucose coming into the bloodstream, what happens is the insulin shoots up and it overshoots, and you have to pump out a whole lot of insulin. And over time, namely years of this type of diet, it causes the beta cells to become exhausted, and then they stop responding to glucose. So that explains why the connection between this correlation that they saw and diabetes. So that was a correlational study. So it was followed up with clinical trials. And in the clinical trials, one of the categories that they wanted to use is they wanted to know if you have people who don't have diabetes, and if you give them a diet where you ask them to focus on glycemic index, can you prevent diabetes, or actually lower blood glucose? And there were 2 clinical trials that have been done of this type. One said, yes, glycemic index matters, and that you, by doing, paying attention to glycemic index, you can actually improve blood glucose levels. But then another study came out saying, no, it doesn't have an effect. And when you see these conflicting studies, remember our criteria that I talked about at the beginning of the semester. You have to have at least 2 studies, clinical trials, good clinical trials, that agree in order for you to begin to generalize to the population. So these clinical trials doesn't meet that criteria. But let's talk about a different group, which is diabetics. So if you have diabetes, you already have a problem with glucose insensitivity for type 2 diabetes. And there have been a number of clinical trials that looked at if diabetics are asked to focus on the glycemic index of the food that they eat, will it reduce their blood glucose? And in 8 out of 9 of the clinical trials, they did see a significant reduction in blood glucose by focusing on glycemic index. So to extrapolate, if your patient is a diabetic, then talking about the glycemic index can be a help to them, because it perhaps helps them better control their blood glucose. But if you're a healthy person, then the glycemic index is not going to prevent it, because it doesn't cause diabetes, type 2 diabetes. But once again, for pre-diabetics, there's now one clinical trial where they looked at, not at blood glucose, but at weight loss. And one thing that's tricky is that if you have diabetes or you're approaching diabetes, the regulation of your energy stores is all out of whack. There's many things that go on, and it's really hard for people once their blood glucose levels are messed up to lose weight and to do so safely. So in one clinical trial, they found that if they included information about glycemic index foods and asked the patients to focus on that as part of their weight loss plan, those people who had that information were more successful at taking off the weight. And for comparison, they had people just focus on low fat.